good afternoon, everyone. My name is Amy, and we are from the WIA project. And if it's your first time joining us today, very welcome. Today we are doing another episode, and today we're so fortunate to have a very, very lovely flying doctor with us. Her name is Dr. Vika, and why don't you share a little bit about yourself?
Hi, good morning, everyone. It's my pleasure, and thank you so much for having me here. Okay, my background actually, I'm a medical doctor, and I'm majoring in aviation medicine. And after graduated from aviation medicine, specialist in actually October 2016, I have worked in the medical evacuation. I have worked both as a coordinator and also the escort doctor.
Mm-hmm.
And starting in July 2020, during the pandemic, actually, I set up my own company named FlyDoc. I set up this company just to make aviation medicine more familiar and relatable for all stakeholders in aviation world, and also, most importantly, to bring healing for the patients.
Wow, that's really amazing. And actually, you are our first medical personnel, like and doctor that we are interviewing today. So, like, what gave you the idea to, to actually become a flying doctor?
Actually, I had no idea what
Uh-huh.
is flying doctor until I graduated as a medical doctor.
Uh-huh.
As an, and then I got very, you can say, overwhelmed by the medical world.
Mm-hmm.
And actually, I have a free spirit and trying to see another opportunity. And then I bumped into aviation medicine. And then, well, the fate take me here.
Mm-hmm. So tell us a little bit more. What is a flying doctor? Maybe a lot of people don't know maybe what a flying doctor is. They know doctors, yes, the doctors in hospital, but maybe they don't know what a flying doctor is.
Okay, flying doctor. Why I name it flying doctor? Because I'm a specialist of aviation medicine.
Mm-hmm.
Aviation medicine specifically, it learns about the human body change in the flight environment. We know that there are some health risks in flight, especially for patients. For our normal body, we can tolerate, but for some patients, they are very vulnerable to have a worse condition during flight. I think for pilots and all the engineers, we all know that aviation environment are designed to make our human body should be adaptable. Yeah,
True.
like
True.
there are some risks like hypoxia, there are
Yeah.
the change of pressure, there are change
Yes.
of temperatures, and for the patients for some specific with some specific medical conditions,
Mm-hmm.
the risk can worsen their condition. So we, as aviation medicine specialists, should do all the assessment
Mm-hmm.
and to give advice what we should do to mitigate the worsening condition. So the
Mm-hmm.
patient can be transferred from hospital A to hospital B safely.
Yes, and most of the most in your experiences, like the aircrafts that are used, they're mostly like smaller aircrafts, right?
Yeah, it's smaller aircraft.
And they're generally like they're non-pressurized aircrafts as well.
Oh, not really.
Not really, they're mostly pressure. Yeah,
Yes, we
because
have used jets
jets as well.
like this jet. They are pressurized
Mm-mm-mm.
because the non-pressurized aircraft usually they cannot go long range, right?
Right, right.
Yeah.
Because
So
I
it
guess
all
like
depends.
yeah, I mean as a medical doctor, you have to take that into consideration as well, right? Because you're saying the effects of the pressure in terms of the body for the patient as well.
Yes.
So it's just yeah, that plays a role into that. But so like what's your everyday like what's your typical day like now as a as a aviation doctor?
Well, our typical day is that whenever we have a client who needs to be
Mm-hmm.
transferred, and then we will take the inquiry. And then usually I have a team. Medically, I will assess the patient,
Mm-hmm.
the fitness to fly. Uh, what are the risks, how to mitigate, what should we prepare, the equipment and the medications. And then my other team, the operations, they will try to look for the suitable uh, aircraft and then the ambulance and all the administration things.
So it really is a lot of work to get all this, you know.
Yeah. And then everything is set and I deem the patient is transportable and fit to fly. And then we can start the process. And if I escort it myself, and then I will fly along with the patient.
Mhm. That's great. Then like so like your role, is it like generally contained within Indonesia or is it like more regional? Well, where does your work normally like located in?
Uh, FlyDoc is based in Jakarta, but
Mm-hmm.
our service cover for the domestic and international flight. But during the pandemic, it is very restricted to border
Mm,
restriction. Usually, if we transfer the patient to other country, our medical team just do the tarmac transfer, and
mm,
where we drop the patient in tarmac, and
mm.
the receiving hospital will help to arrange the ambulance to pick up the patient, and then the medical team fly back to Jakarta.
Wow, amazing. Like so how I'm sure you must feel like this role is like really rewarding in some sense.
Uh, yes, it's very rewarding because as a doctor, I always have a patient to serve and to care for people for the improvement for patients. But me myself, I have quite a free spirit,
Mm,
and I do not to staying and contain in one place. It's not me.
mm, mm.
So it's very rewarding for me because I can do both. I can still have a I mean, like I can still flying and
Yeah.
travel, and then I can still serve people. So
Wow.
it's very
So
rewarding for me.
So this job is like the best combination. You can practice as a doctor and then you're also still out and being
Yes,
adventurous. That's great. Well, like our WEA project, it's a women's in aviation project. How do you know of any more women who have the same role in your like region?
surprisingly, aviation medicine, a lot of incredible women works in this
Really?
field. Like, yes, we
Oh.
have a very experienced flight nurse. She's very good,
Mm-hmm.
and also our operation team.
Are
But
also
but I haven't met any female pilot working
okay.
with
I'm coming
me in this. Yeah,
soon.
very welcome.
All right. I definitely want to. So you haven't met any female pilots yet, but mostly female doctors and
Female
female
nurse.
nurses.
Yeah.
Correct. Wow, that's amazing. So like just if you can like just tell me more information like from the start of it till the end of it. What normally happens? Like what are the processes like daily like if you were to transport like a patient.
If I have to transfer the patient, then
Hmm.
first, of course, the
Hmm.
patient must be transportable. We
Hmm.
have to think about the risk and the benefit for the patient, whether it's better to keep them stabilized in
Hmm.
current hospital or we can just transport them safely. And
Hmm.
then if I have to go with myself, and
Hmm.
then I have to prepare all the medications, I have to bring all the equipment. That's
Hmm.
why the communication between the transporting doctor and also from the origin and receiving hospital is very crucial because we receive the information from the current hospital and we need to tell them to the next destination, right? So
Hmm.
they also be noticed that the patient is coming and what the ER should prepare to take the patient. And then during the flight, um, we will do monitoring. So our service are always bed to bed. So from the bed of the current hospital, we will take with ground ambulance to the air ambulance, and then take the patient again with ground ambulance to the destination. Uh, for all the process, it's
Hmm.
basically monitoring and adjusting the patient condition if they have some symptoms, give some
Hmm.
medications and treatment on board like that.
Oh, wow. It really is a long, I mean, it's quite a process.
Yeah.
Yeah, I remember Dr. Vika, earlier you were telling me about a young man that you were working with. Like, can you tell me a little bit more about that story?
Okay. Actually, and since I have told you before that we are heading to
Mm,
work with some more organization to make the Medivac actually
mm,
accessible
mm,
even for the needy people. Yeah.
yeah.
Yeah. It was a young man, a student, and then he got infection. We call it myelitis in
Mm,
the backbone. So
mm,
he got paralyzed. So we considered because this patient coming from Papua and he was studying in Yogyakarta.
mm,
So the donator actually he studied this with the scholarship.
mm-hmm,
So based on the consideration, the family decided to take him back home to give him better treatment with the
mm-hmm,
people he loved.
mm-hmm,
So we did the fundraising because they cannot afford the Medivac. You know, we all
mm.
know that Medivac is quite pricey. So we work along with the organization and with the teachers to do the fundraising until we can get him back home.
Wow, that. I mean, that's really amazing in the sense that you're also working towards helping people
Yes.
who cannot afford it, and that's good because we need more of a system like this. Wow. So, Dr. Vika, you're a great example. What kind of advice would you give, to the younger generation who I'm sure look up to you for what you do?
Uh, what would I say is we all we all as a aviation community we have to do our part to
Mm,
make sure and to improve aviation safety because we know that there are so many parties involved in this aviation world, right? There are
yeah.
pilots, air crew, the ground handler, and then the immigration and even the port health and the doctor and etc. So we all have the small part and we have to work together to improve the aviation safety because we know that once we fly we cannot go anywhere, right?
Yeah.
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 So it's very important to always do our part the best.
I totally agree with you on that. Totally agree.
Thank you, Amy.
Wow. Yeah. So, like, what do you think our initiative, the WIA project? What are your thoughts?
I think it's a very great platform to help women who want to pursue their career in aviation world because we know this is still male dominating, and with RIA I think we can inspire more women to take part.
Um, True, it is true. So, like, last words, Dr. Vika, do provide us a quote that has, like, maybe inspired you or has sort of been your mantra for for what you're doing.
My mantra for my work, I always remember one of my lecturer always told us when I was still studying. He told us that the sky is safe, but there's no room for error. So
Wow.
I always take that word. So yes, the sky is safe, but once we get on board, there are no ER available. We are
Mm,
the only medical assistance the patient have. So we have to prepare everything the best. And I usually do the review very carefully for the patient's condition.
wow, that's great. Wow, thank you so much, Dr. Vika, for your story, for what you do, and your inspiration. And yeah, so there you have it, ladies and gentlemen. I hope this episode has really encouraged you, and maybe to move forward, to pursue a career in aviation. Young ladies out there, you can do it. You can do everything that you aspire to. If you want to be an aviation doctor, like Dr. Vika, go ahead, message her. She's on LinkedIn, and we appreciate your time and for watching this. All right.
Thank you, Amy. Thank you, everyone, for having me.